The first one we are going to talk about is the logistic assistance in the Zurich. Logistic assistant in the Zurich. Like it's just translated, logistic assistance in the health care. There is a course currently running through the VDRB. They are offering that program. It's a 6 months uploading or 6 months course. It requires a certain amount of theory. Don't think logistic, don't they learn theory? They also learn theory. So it requires a certain amount of theory, a certain amount of practical, alias stage or internship. You are mostly posted to hospitals and elderly homes. The job that I have seen the people don't do is work in the ward in the hospital. In that ward in the hospital, you're going to ask me, what are they doing there? Okay. For example, now they take care of the food and distribute the food to the patient. Am I saying I as a nurse no longer distribute foods to patients? That's a lie. I still do that, but I'm just saying that is the main job of the logistic assistant in the Zurich or the logistical assistant in the health. After the food is done, they clean up the place, they tidy the place that the patient ate and return the card or the thing back to the kitchen. And while I as a nurse are finished taking care of injuries and my healthcare assistants are finished cleaning up my patient, the logistic assistants can help us arrange the ward. Like most times they help us to make the bed, because if I finish washing my patient, I have to go move on to the next one, other things as a nurse. So the logistic assistant, they make the beds in the ward. That's another job that they do. They take care of the food, they make the bed. Most times the kitchen activities belongs to them. They take care of the kitchen, they clean the kitchen, just actually make sure that everything is sorted out. Another thing that I've seen them do in the hospital is that they take care of the material. Like I as a nurse, I shouldn't be thinking in my head how many wound injury sets. To take care of injuries, you need those sets, those instruments. You need those instruments. I'm not thinking in my head if I still have enough instruments for tomorrow. I don't do that. Before, I used to do that. But now I don't do that anymore, because that's the job of the logistic assistant in the Zurich. They count the amount of instrument that I need. They see the ones that are still remaining in the instrumental place. They count it and fill it in for me. So they take care of the food. They help. They assist, like the word says, they assist the nurses or the healthcare assistants in doing their take care of the food. They make up the beds for us. They do the inventaries in Netherlands. If you don't know this in English, inventaries. They take care of the. Make sure that I have enough bed linens. I have enough wound injury set to take care of my patient. Like if my parameters instrument are spoiled, they know where to order them, how to get them. They just do the inventaries in the distance. That's what they mostly do. That one is in a hospital. Like I've said previously, it doesn't matter if you are starting here, you can always level up. You get, but these people can also work outside of the hospital. But the only training VDRB is giving you is to train you for hospital, because that's where they need you, because nurses are running away. The work is too much. You can also later go work in the elderly people home. What you do there is mostly the same thing. You take care of the food, you take care of the bed linens. You just make sure that one or two things are okay. But in the elderly home, these people are mostly set in as have a bit of cleaning ladies, cleaning people. You understand? That's why I will advise you to stick to the hospital, because hospital is the perfect place. You are going to have the motivation to level up. Thank you.